best treatment options for Dermatitis Papulosa Nigra or DPN. Today we are exploring a topic that many of you have been asking about. Dermatitis Papulosa Nigra, commonly known as DPN. These small, dark and benign skin lesions are quite common, especially among individuals with darker skin tones. While DPN is commonly harmless, it's understandable that many people seek treatment for cosmetic reasons. In this video, we'll examine the best treatment options available for a DPN so you can make an informed decision on the best way to manage these lesions. And welcome to our channel. I'm Dr. Chiranjaya and this is your ultimate cyberspace for glowing and healthy skin. Before we explore the treatment options, it's important to understand what DPN is. Dermatitis Papulosa Nigra is a condition characterized by the appearance of multiple small, benign and darkly pigmented papules, primarily on the face and neck. These lesions are more common in individuals with African, Asian and Hispanic descent, and they tend to increase in number and size with age. DPN is often mistaken for moles or other types of skin growths, but it has its own distinct characteristics. The papules are usually smooth, round and flat or slightly raised with a diameter ranging from 1 to 5 millimeters. While DPN is benign and doesn't typically cause any physical discomfort, there are several reasons why individuals may seek treatment. The most common reason is cosmetic concern, as these dark lesions can be particularly noticeable on the face and neck. In some cases, these papules can grow large enough to become irritated or catch on clothing or jewelry, leading to discomfort. Additionally, for some individuals, DPN can affect self-esteem and confidence, prompting them to explore treatment options. When it comes to treating DPN, there are several effective methods available, each with its own advantages and potential side effects. It's essential to consult with a dermatologist to determine the best treatment approach based on your skin type, the number and size of lesions, and your personal preferences. Electrosurgery is one of the most common and effective treatment for DPN. This method involves using a small electrified probe to remove the papules by burning them off. The heat generated by the electric current destroys the lesions, causing them to fall off after a few days. The advantages of electrosurgery include precision in removing each lesion without damaging the surrounding skin, high effectiveness in removing multiple lesions in a single session, and minimal scarring when performed correctly by a skilled dermatologist. However, some patients may experience mild pain or discomfort during the procedure, though this can be managed with local anesthesia. Additionally, the treated area may form a scab, which will heal over a week or two. So proper aftercare is essential to prevent infection and minimize scarring. Cryotherapy is another popular treatment option for DPN. This technique involves freezing the lesion with liquid nitrogen, which causes the papules to blister and eventually fall off. Cryotherapy is a relatively quick procedure, often completed in a matter of minutes, and most patients can resume their normal activities immediately after the treatment. However, there is a risk of hyperpigmentation, which means lighting of the skin in the treated areas, especially in individuals with darker skin tones. Additionally, some lesions may require multiple cryotherapy sessions to achieve complete removal. Laser therapy is a modern and increasingly popular method for treating DPN. It involves using focused laser energy to target and vaporize the pigmented lesions. Laser therapy often offers high precision, making it ideal for treating small, delicate areas like the face. Most patients report minimal discomfort during the procedure, which can often be performed without anesthesia. The recovery time is generally short, with most patients experiencing only mild redness or swelling that resolve within a few days. However, laser therapy can be more expensive than other treatment options depending on the number of lesions and the type of laser used. Additionally, there is a risk of post-inflammatory hyperpigmentation as well as hypopigmentation, especially in individuals with dark skin tones. Surgical excision involves physically cutting out the DPN lesions using a scalpel. This method is typically reserved for larger lesions or those that have not responded to other treatments. Surgical excision provides a definitive removal of the lesion with minimal risk of recurrence in the treated area. Additionally, the excised tissue can be sent for histopathological examination to rule out any other skin conditions. However, there is a higher risk of scarring compared to other treatment methods, especially if the lesion is large or if the procedure is not performed with precision. The recovery period may be longer, and the patients may need to take special care of the wound to ensure proper healing. While less common, some dermatologists may recommend topical treatments for DPN. These treatments typically involve the application of a prescription strength retinoid or other lightening agents to help reduce the appearance of the papules over time. Topical treatments are non-invasive and can be done at home, and they work gradually, which may be preferable for patients who wish to avoid more aggressive procedures. However, topical treatments are generally less effective than other methods and may not produce significant results, especially for larger or more numerous lesions. It may take several months of consistent use to see noticeable improvements. DPN is a common and harmless skin condition, but it can be a source of cosmetic concerns for many individuals. The good news is that there are several effective treatment options available, ranging from minimally invasive procedures like electrosurgery and cryotherapy to more advanced techniques like laser therapy and surgical excision. Each method has its own set of benefits and potential side effects, so it's important to consult with a qualified dermatologist to determine the best approach for your specific case. Remember, while DPN is not a medical concern, it's perfectly okay to seek treatment if it affects your confidence or self-esteem. Whatever treatment you choose, ensure you follow your dermatologist's post-procedure care instructions to achieve the best possible results. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more skin health tips and insights. Thank you for watching.